Hi, I'm Dr. Gary Gruber, and I'm here on a video chat with Dr. Rick Liva, who's the president and legislative chairperson for the Connecticut Naturopathic Physicians Association. And today we're going to give everyone some information about the 2015 legislative update. So let me welcome Dr. Liva.
Good to be here, Gary.
Thanks, Rick. Thanks for getting together with me today. So
Sure.
I'll ask you a question, and give us some of your thoughts on some of these legislative updates. So,
Sure.
First question: why does the law covering the naturopathic scope of practice need to be changed?
Very simply, the law was enacted in 1923. It's roughly 91 years old, and it has not kept pace with the education and training of naturopathic physicians, and therefore needs to be substantially modernized. As you may know, most states that license naturopathic physicians have robust drug authority, and drug authority is what we're asking for in this legislative session. And other states that have drug authority have had it for quite a few years. For instance, Oregon has allowed their naturopathic doctors to prescribe various medications since 1984, which is 30 years ago. And I might add, the safety record for naturopathic physicians prescribing medications in other states is very, very good. So, in summary, the law is too old, needs to be brought up to par with education and training. What we're after is drug authority so that we can provide more primary care services to our patients.
And how long has the CNPA been working on this project of trying to expand and modernize the scope of practice?
Well, I would say the most recent effort started 3 years ago. It didn't go anywhere 3 years ago. The second year, we had to do that scope of practice, Department of Public Health process. A document was written, but the Department of Public Health did not choose to allow us to go through that scope process. In 2013, we wrote another document that was quite robust. The Department of Public Health did choose it. We went through the committee process for the scope of practice, and in the 2014 session, we asked for prescriptive authority and some modernization of the language. We did not get prescriptive authority, but we got some modernization of the language, and we also got the ability to prescribe durable medical goods and medical devices. So here we are in 2015, and we're basically trying to do what we have to do to get some degree of prescriptive authority.
And my recollection is, Rick, that the document that the CNPA prepared, this very robust document that was prepared and submitted to the Department of Public Health, is available online, and also the response of the outcome of the Department of Health is available as well.
Correct.
Okay, so that's available online, and we can make that available to anyone who's interested in having that information.
Sure.
Okay, so in all of this, who do you think is going to benefit from this modernized scope of practice?
Well, you know how they say in real estate, Gary, the most important thing is location, location, location. Well, regarding this law upgrade and modernization, I would say it's patience, patience, and patience. Obviously, people come to us all over Connecticut with various health problems, and this authority would allow us basically to do a lot more than we can do currently under the same roof. So if someone needs some kind of prescriptive therapy, we can manage that. we can take care of that. So the patients are really the biggest recipients of benefit to a modernized law for naturopathic doctors. And as you well know, we have full diagnostic capabilities in Connecticut. We can diagnose acute disease, we can diagnose chronic health conditions. However, if a drug is actually needed as we diagnose somebody and we cannot provide it, the patient has to wait to go back to their medical doctor, go to a walk-in clinic, go to the ER, or in some cases wait weeks to see specialists. This wastes time, is a huge inconvenience for the patient. It may delay treatment and could cause more discomfort. The patient pays more for other co-pays. The MD, which we probably are all familiar with, may not agree with the treatment plan recommended by the ND, and the patient leaves with no resolution. Insurance company gets billed twice. And if the patient, well, there's a whole other scenario. If a patient comes to us and says, I'm on a bunch of meds, or I'm on 2 meds, and I would like you to help me reduce some of those meds, we need prescriptive authority to be able to help them reduce, because you legally cannot help someone reduce a drug unless you have the authority to put them on it. So that's a whole other issue, and that's where also patients tend to benefit. We can help them if they're willing to do more lifestyle and other natural medicine kinds of interventions. We can help them either use less medication or get off of medication. In addition, besides patients, it's the naturopathic medical students at the University of Bridgeport College of Naturopathic Medicine, and in total, the school benefits as well. Right now, the school and the students have to go through all kinds of rigmarole to efficiently meet, or I should say to meet, the educational mandate that's put out there by the CNME. So this law would allow the school and the students to more efficiently meet that educational mandate. And at the end of the day, NDs will benefit as well because they'll be able to deliver more primary care services.
So it really sounds like it's a winning proposition for many different groups. You've got the patients who benefit. You've got the students who benefit because they get better quality education in a more efficient approach. And the doctors benefit as well because they're able to provide a more comprehensive approach to treatments for their patients.
Absolutely.
Yeah. So we've got 3 groups that would benefit: the doctors or NDs, the students, and the patients.
Right.
So tell me, what can they do to help support your effort or the CMPA's effort to modernize the legislation?
Well, I want to deal with that in a second, but there's something that I wanted to speak about for a moment. Because when we've gone to legislators, one of the things that legislators have said, and this will parlay right into what people can do to help, but they're going to be met with what I'm about to say. And legislators have said to NDs going to them, talking about adding prescriptive authority to the scope of practices, and they say, well, you're natural medicine doctors. Why do you want to use drugs? And they're confused, and I can see their confusion on some level, but our response to that is, well, we're well-trained physicians who can use medication. We just don't have the prescriptive authority to do that, and not everything can be managed by a natural medicine approach. There are some cases where people absolutely need drug therapy, whether it's short-term or long-term. So I wanted to talk about that just for a moment so that people aren't kind of dumbfounded and say, well, how do I respond to that? Well, the response again is we're well-trained physicians who can deal with a variety of clinical situations. Natural medicine is our preferred mode of treatment, but we also want to take care of the patient's needs by using drug therapy when it's absolutely appropriate.
Okay.
So actually, I want to add one more thing because people should know this as they start doing things to support our effort in talking to their legislators. The medical doctors are our largest opposition here, and they lobby legislators very hard to tell legislators that legislators should not grant this for naturopathic doctors. And their big bugaboo is that we're not educated and trained enough, and it's going to be a public safety threat. What I want people to know is that naturopathic doctors in other states have a very, very, very good safety record prescribing drugs in other states. And we presented that evidence at our scope of practice hearings with the Department of Public Health in front of the medical doctors. They didn't really listen to it or accept any of it because their position is still the same thing. We may pose a threat to the public safety. However, I want people to know something. The medical doctors have no data, no evidence, no documentation whatsoever that says that NDs cause harm when NDs use drug authority in other states. So I want people to know and remember that.
Thanks, Rick. I just want to follow up a little bit with that because I did read the document from the Department of Public Health, which was the outcome of the discussions to expand the scope of practice. And they specifically say in that document that the medical opposition did not provide any evidence to dispute or rebut the fact that that naturopathic physicians in all of the states that have prescriptive authority have a very clear and good safety record.
Correct.
Yep. Yep.
So, getting back to your question, your third question, how can people help?
Right.
Well, it's very simple. Naturopathic doctors, patients, friends, and advocates could be talking to, emailing, and when I say talking to, ideally it would be face-to-face. If that's not possible, certainly on the telephone, and then sending letters and emails to their legislators to basically say, I'm an ND, I'm a patient, I'm an advocate for this kind of medicine. I would like you to support NDs getting prescriptive authority in the state of Connecticut.
Right. And so we have a couple of slides that we put together to show people a simple way to send an email, right? An email. Right. Using the computer system that the CMP has, and we've made it very, very simple. So let me see if I can pull up those slides. Okay, so the first thing it looks like, okay, so the first thing we would have people do is go to the CNPA website, which is www.cnpaonline.org, and you will come to this homepage that you can see here on this slide, and at the top you would select from the selection bar about the you can see the red line there, the arrow points to that. Then that will take you to the next web page where you will see a number of different categories on the right hand side where it says write an email to your legislator. So the first one is for the licensed naturopathic physicians, and when a ND clicks there, it will take you to another screen where you will complete some information and the letter will be sent directly to your legislators. Again, there's a separate section for medical students and then a separate section for patients, friends, family, and supporters. And the reason that we did it this way, Rick, is because each separate group has a really special interest in supporting the modernization and the benefits that they see. So the letters that are pre-printed, the templates, address these specific issues for each category. And so the next thing, once you click on your particular category, it takes you to another page, and this is an example of the patients, friends, family, and supporters category. You would complete the information of your street address, your zip code, and then you click on the group, a little pull-down menu, and you select the Connecticut state legislators. It's the only one that you can select. And it's that simple. Fill out this information. It takes you to another screen. It asks you some more personal information. It automatically formats the letter for you. It automatically selects your state senator, your state representative. It addresses the letter personally to them. And very important, there is a area in the letter where you can type in your own personal message to personalize the letter. You do not have to do that, but it's really very advantageous for us if each person were to personalize the letter that's sent to the legislator.
Can I say something more about that, Gary?
Sure, go ahead.
As you and I talked before we did this video, I want to stress the importance of putting personal information into that letter. We're actually going to change the template structure so that the personal information will be at the top, and then there will be other information at the bottom, because legislators hate form letters. They don't look at them. Once they see there's a bunch of form letters coming in, they just start to ignore them all. So personalized information inside of your letter to a legislator is really, really important. I would even recommend that you say right in the first line, this is not a form letter, please read, and then go on with whatever personal information that you want to put in your letter. So we encourage everybody to write to your legislators, and don't just do it once. Ideally, you would do it more than once. The session doesn't end until June, the first week in June. A lot of things are going to happen along the way, and we'll certainly keep people informed as to what happens and when, but please remember that a couple letters or more to your legislators are very much in order.
That's great, Rick. Thank you. I think that stressing that more than one letter is very helpful, and the process is going to be ongoing throughout the spring. People should hopefully pay attention to their email inbox, where the CMPA will be sending emails, constant contact emails to people. We will be posting blogs as things change. We will be using our Facebook page. So if you don't like our Facebook page yet, please go to it and like the page. We do publish a lot of information there ongoing, and sometimes it's even faster than the emails that go out. So we try to keep everything up to date. Anything else you want to add before we leave?
I guess the only thing I'd like to add is I highly encourage NDs, patients, families, and friends to send the emails and meet with, if you can, legislators, because that's the only thing that really tends to sway them, is public advocacy and keeping in touch with them to voice your desire.
Okay, Rick. Thanks very much, and
right.
I hope we'll do this again, because it gives people a lot of good information, and keep in touch and with our supporters. And thanks again. Have a good day.
Yeah, you do the same.
Okay.
Thank you.
All right.
Bye-bye.
Good. Bye.